So hey guys, my name is Shrek Harigaonkar and today I'm going to be talking about systemic effects of inflammation. So let's get right to it. So whenever you start talking about any question, you want to speak about like you want to have a map of the important points and then like build up on that. So through in this PowerPoint, we'll be going through these important points. So what it is about, the acute phase response, fever, acute phase reactants, leukocytosis, flu-like signs and symptoms, sepsis, and SIRS. And these two are pretty important to know, especially in the clinical years. So first we talk about what is. So inflammation in general is a response of vascularized tissues to infections and tissue damage that brings cells and molecules of host defense from the circulation to the sites where they are needed to eliminate the offending agents. So in general, whenever you start off any question, you want to start off with an introduction, which should, in most cases, involve a definition. So that's the definition that you need to remember. Inflammation usually it can be localized and is often associated with cytokine-induced systemic reactions, and that's basically what an acute phase response is, which brings us to the acute phase response. So the definition of an acute phase response is that it's a prominent systemic reaction of the organism to local or systemic disturbances in its homeostasis caused by infection, tissue injury, trauma, surgery, neoplastic growth, or immunological disorders. And it's often associated with cytokines. And as mentioned, it can be local, it could be systemic, it could be due to a wide variety of reasons. And each and every inflammation usually has its acute phase response. Yeah, so now we have fever. So fever in general is one of the most notable symptoms in an acute phase response. And the normal temperature for a human is approximately 36 to 37.5. However, we usually consider fever as a body temperature above 37 degrees. And the examiners may ask, how does the fever happen exactly? And this is basically what you need to know. So initially you have some kind of immune response, like it could be infections, toxins, injury, inflammation, whatever, which is basically inflammation. And you have certain cells that can release these cytokines, out of which the most important one is interleukin 1. And this is TNF, so it's the human necrosis factor. These immune response mediators, they travel like usually locally to leukocytes, and these leukocytes could be like monocytes or macrophages. They could be neutrophils, lymphocytes, endothelium, etc. And cytokines, they stimulate the leukocytes to release what is known as pyrogenic cytokines. So pyrogenic in this term basically means fever inducing. And these leukocytes then release interleukin 1, TNF, and interferon. And these newly formed cytokines, they travel into the bloodstream and they migrate towards the brain, basically, where you have the hypothalamic endothelium. And they stimulate a specific nucleus within the hypothalamus, which is known as the median preoptic nucleus. So just for information. And they don't stimulate, sorry, they inhibit the median preoptic nucleus, and that leads to a production of prostaglandin E2, and this results in an elevated set point. And as a result of this, you have fever. So coming to the acute phase reactants, so in general, acute phase reactants are proteins that are elevated during an acute phase reaction, and this usually involves cytokine-induced synthesis of these proteins by the liver, the most important of them being interleukin 6. And these can be divided into positive and negative acute phase reactants. So in general, positive acute phase reactants, they they increase in concentration during an acute phase response, whereas the negative acute phase reactants decrease in concentration. So again, in positive, you might have different categories. So you can have early a positive acute phase reactant. You could also have intermediate. You can also have late acute phase positive acute phase reactants. So early, they usually increase 100 times within the first 2 to 10 hours. And the most important of them being CRP, which stands for C-reactive protein. Uh, it's an opsonin, and this basically means that it helps in activating classical complement pathway, and it's especially useful against Streptococcus pneumoniae as it binds to its cell wall. So in general, CRP can be elevated in bacterial infections. It can be elevated in viral infections. However, it's not that high compared to bacterial infections. It can also be elevated in some kinds of generalized inflammations or or some kind of neoplasm as well. So it's not specific, but it is a very sensitive marker for inflammation. The next one is procalcitonin. So these are formed from the C cells, the thyroid gland, and a precursor for calcitonin. And as a result, they help in regulating calcium levels. The next one is serum amyloid A. So these are synthesized in the liver as well and circulates bound to HDL. And these have a lot of functions. One of the important things to know is that they're actually the precursor to AA amyloidosis. Then you have the intermediate ones. So these increase 2 times in 12 to 36 hours and mainly function to stop tissue damage from inflammation. So you have alpha 1 antitrypsin, which is a protease inhibitor, and it inhibits different kinds of inflammatory enzymes, the most notable one being neutrophil elastases. A deficiency in this, as you will learn in your special pathology, it's associated with liver cirrhosis as well as emphysema, specifically Panacea emphysema. You also have alpha 1 acidic glycoprotein, which is a carrier of basic and neutrally charged lipophilic compounds, as well as haptoglobin. So this binds to free hemoglobin and prevents its oxidative activity. You have fibrinogen, as you guys know, participates in coagulation, and hepcidin, which is another important one, which regulates iron levels in the blood, in the body, specifically in periods of chronic inflammation. Hepcidin levels are pretty high. As a result, people may be associated with what is known as anemia of chronic disease. You also have late acute phase reactants. So these usually have a mild increase in about 9 to 72 hours, out of which you have celluloplasm, which carries copper as a peroxidase. So it basically oxidizes iron to like ferrous to ferric so that it can be bound to transferrin. And you have C3 and C4, which form the complement system. And finally, you have the negative acute phase reactants. So one of the most important ones being albumin. So as you know, albumin has a lot of functions. It's like the major determinant of oncotic pressure in the blood. It acts as a protein reserve, and it also carries positively charged molecules like calcium, for instance, or certain drugs. You may also have prealbumin. So this carries T4, which is the thyroxine hormone, in blood as well as in CSF. And transferrin, as mentioned, transports iron. So the next thing you have, which you need to mention, is leukocytosis. So this is one of the most common features of inflammatory reaction, especially bacterial infections. And the normal levels are given here. It may be 15,000 to 20,000 cells per microliter, but sometimes it may reach extraordinarily high levels of 40,000 to even 100,000 cells per microliter. And therefore, this must be distinguished from leukemia. In leukemia, you usually have additional features that can help in differentiating it from leukemoid reactions. So leukocytosis is also known as a leukemoid reactions or leukemia-like reaction. And in leukemia, you will have different kinds of symptoms as well. So you can have like splenomegaly. The cells are usually atypical and immature, and you usually also have elevated basophils, which are usually not common in infections. And finally, you also have low neutrophil alkaline phosphatase levels, which are basically associated with high levels of neutrophil activity. So in leukemia, if you have low neutrophil ALP, it means that the neutrophils aren't doing their job. Different cells may be the predominant cell in different types of infections as well. So, for instance, you can have neutrophils in bacterial infections, or you could have eosinophils in parasitic infections. You could also have lymphocytosis in viral infections. And the leukocytosis usually occurs initially because of the accelerated release of cells from the bone marrow post-mitotic reserve pool. And these, as mentioned, these cytokines are pretty important ones, like TNF and interleukin-1, and is therefore associated with a rise in the number of more immature neutrophils in the blood, and this is what is known as the left shift. One important point is that certain infections are associated with a decreased number of circulating white cells, and this is what is known as leukopenia. You also have flu-like signs and symptoms. So these are usually the most common signs when someone has any kind of inflammation, right? And these usually involve increased heart rate and blood pressure, decreased sweating, shivering and chills, as a means to increase the body warmth. You also have anorexia, which is decreased appetite. You have malaise, and which is like fatigue and somnolence. So the next thing is sepsis. So sepsis is basically a state that's associated with um, organ dysfunction due to some kind of infection. So usually bacterial infections, and the large amounts of bacteria and the products in the blood, they basically stimulate the production of enormous quantities of several cytokines, the notable ones including TNF and interleukin-1. And in worst cases, sepsis can transform to what is known as septic shock, which is characterized by high blood levels of cytokines, and clinically this may be associated with disseminated intravascular coagulation as well as hypotensive shock and other metabolic disturbances like insulin resistance and hyperglycemia. So last but not least, we have systemic inflammatory response syndrome. So this is basically a delocalized and dysregulated inflammation, which leads to disorders of microcirculation, organ perfusion, and secondary organ dysfunction. So it's pretty severe, and if not maintained in time, can lead to coma and also death. So thank you.